Thanks for joining us on Morning Line on this Wednesday. Nick Barris along with Clint Kelly, malpractice attorney here in town. His office over there in Hendersonville. Nice to have you on.
Thank you.
It's
good to be on.
You know, and we got the lines open, 737-7587. Just before I came up here, one of my colleagues here at the station said, hey, would you ask Clint a question for me? I go, sure. And he said he was wondering about hospitals that maybe, in his opinion, prematurely release a patient. His father had been in and was released, and when he got out, he had these bad sores and stuff that were still on his body that hadn't been properly treated, and he's kind of a mess now. I had to run up to the studio literally before I could quiz him more, and he had to go to a meeting, so he can't call in. But what about maybe could that be malpractice, being prematurely released?
Absolutely.
Okay.
I mean, it's the hospital is not responsible for discharging you. It's the physician who's in charge of your care. That's who makes the decision, the attending physician.
Okay.
And if the attending physician discharges someone prematurely, any injuries that are caused by that premature discharge is on that doctor. The doctor's responsible for it. Now, Nick, there has been a big change, again, to the Medicare Act. They are now doing audits of hospitals to find out whether patients who have been discharged get sick within 30 days of the discharge, and it's related somehow to the sickness for which they went to the hospital.
Yeah.
And in those situations, what Medicare is doing is they're requiring the hospital to pay for that subsequent treatment, because there's been a big push now to get hospitals, and it's the physicians in the hospitals, to make sure patients are treated appropriately and healed up well enough so that when they go home, they don't come back.
Which ultimately, in the long term, saves everyone money. That's their idea. Get them better, get them out, and they can get on with their lives. So you're saying that in a lot of these cases, these hospitals are, like you said, just binding them up, treating them, and get them out of here as fast as we can to save us money, and hopefully we won't see them again.
Yeah, the physician will rubber stamp the decision, but that's the big push. So that the push back, if you will, is the government saying we're going to try to save taxpayer money by not having to pay for these people to come back to the hospital because they weren't healed enough in the first place. And a lot of these are infection cases. These are people who pick up an infection in the hospital. It's not detected before the patient's discharged.
I'm wondering, it used to be when a woman gave birth, they would sometimes be in the hospital, normal birth, at least a day or such. Now it seems like they check them out so much faster. Any take on that? And has that produced any lawsuits because, hey, they sent them out too fast?
I think, Nick, that's a different situation.
Okay.
I think the medical technology in obstetrics has gotten to the point now where you can actually let people out earlier,
right, and
they will do fine.
Which I don't have a problem if they're healthy, right?
Situations I'm talking about are your surgery patients or particularly your older patients who are basically pushed out too quick before a problem is detected, and then they end up coming back a week or 2 or 3 weeks later and they're really, really sick.
Okay. I wanted to ask you also just about going to a hospital, period, and the infectious. You've said they're one of the dirtiest places.
They're filthy.
What do you mean? Because
you've got people that are coming in that are sick.
Yeah.
They come in with bugs, and from what I've heard from the experts I work with, the sanitation standards in hospitals are not what they used to be 40 or 50 years ago, when they used to heat their instruments up in autoclaves and basically sterilize them. Nowadays, things come in plastic, they're in packages, there are metals that come in packages, and then that raises the question whether or not the manufacturer is doing a proper job to clean those devices or those instruments.
You're saying, because that's what I'm thinking, as opposed to an autoclave and being handled, but the autoclave heats it, kills all the germs. You're getting these prepackaged ones, which I know exactly what you're talking about. And they're tearing it open, but you're not sure how that was handled. Because once it's coming out of that package, they're figuring it's clean, right? They're not autoclaving
And the staff gets lazy with them because they assume because they're packaged properly that therefore there's not going to be any bug on them. And so the staff gets lazy, and sometimes they'll touch them and get a bug on them. The other problem that they're having in hospitals, and this is nationwide, is the antibiotic problem. They're not giving antibiotics after surgeries like they used to because of the superbugs.
Right.
There's so many bugs now that have become resistant to your typical antibiotics that the doctors have been forced to withhold a lot of antibiotic treatment to prevent other bugs from becoming resistant to antibiotics, and all that's done is cause more patients to get sick but not have the antibiotics to prevent the infection. So what I've told you many times, and I'll tell everybody here, is when you go to a hospital and you have a procedure of any kind that's going to involve breaking the skin in a hospital, you're going to have a risk of infection. And unfortunately, you can't always blame the hospital for that, simply because you're in a filthy place.
It's the nature of the place.
It is.
It is. Is there, though, as you said, it slipped over the years, you think, in terms of no longer the autoclaves. Is there a standard that the hospital has to abide by that you could measure if you get an infection and you find clear evidence, say, wait a second, I know there's germs here, but this is awful?
Yeah, I'm sure there are. I have not had a case where I've had to evaluate the sanitation of a hospital. I just know there are patients who've gotten infections, and generally, Nick, it's not the fact the patient got the infection, it's the fact that the hospital staff and the doctor didn't detect it and treat it appropriately.
I got you.
It's the back end aspect of it that I usually look at, as opposed to whether someone just simply gets an infection. Maybe I'm too loose with this, but I've just almost assumed as a basis of medical fact that you're going to get an infection in a hospital from time to time, and there's really not much they can do about it.
Most people, to hear that, I think it surprises them. I don't know about you. He knows. He sees it firsthand, time and again. Let's take a call from Bob. Bob, good morning. What is on your mind, Bob?
I was just recently at General.
Yeah.
Getting an MRI. Don't get me wrong.
Yeah.
Lucky to get an MRI, but when you go in there and there's in jackboot markings on the machine, and it's sparking. This is basically over radiation issues, I guess.
Are you saying that the machine did not look like it was being properly upkept or something like that?
Yeah.
Okay, well, I don't know. Radiation and I had a CT scan the other day. I thought I've got some torn muscle in my abdomen. That's great stuff right there, my friend. But I just remember going in that thing and just I always am thinking, gosh, how much radiation am I getting? Those things are tested. They're what they are, unless there's a malfunction, right? Have you ever had a case involving excessive radiation or anything like that?
Not from a CT scan or MRI, but I do think Bob raises a point that's worth discussing here. I saw the news last night where Metro government is having to decide whether they're going to give an additional $10 million to Metro General Hospital for various items, including payment of vendors. And one thing they said is absolutely true. There have been a number of claims against Metro General Hospital, and perhaps part of that is the fact that they're not being funded properly.
Okay. Now, Metro General, let's say what it is and why it's so important. I mean, I think a hospital, isn't that the place of not last resort, but they're the ones, if other hospitals, for whatever reason, really stabilize someone, but someone needs more and they just discharge them, they end up at Metro General, don't they?
That's correct. Or people who live in the inner city go there, and Nick, it can be the place of last resort.
Yeah. I mean, it's crucial. It's an important thing.
It's our public hospital,
yes.
and that is our last line of defense, if you will, for people who may be uninsured or those who can't get treatment elsewhere, and it needs to be funded properly.
Okay, and if it's not, that's why you might see some of these problems, right? Let's go to Allison. Hi, Allison.
Hi.
Good morning. How can we help you?
Well, I recently have lost my husband.
I'm sorry.
I was going to try not to cry.
Okay, that's okay, ma'am. You take your time. You take your time. And I'm sorry for your loss, but that's all right. You just compose yourself and go on. We want to help you. Go ahead.
Okay. He had sinus cancer.
Okay.
But to fully recover, he was going through chemo and radiation. And he very painful, and they prescribed him some pills to take. Well, he couldn't swallow them, so then they prescribed him some liquid medicine. And he came home on a Friday, made it through Saturday, and on Sunday, he wanted to get outside. We visited with my kids. We played around outside a little bit. He wasn't perfect health, but he was trying to be a good daddy and husband, and about 5 o'clock, he went to sleep, and he never woke up again.
When was this? Was this just very recently?
Yes, in August.
In August, and he never woke up. And so that was unexpected, obviously, since he seemed like he was doing better. What do you think happened?
Well, I know what happened. His cause of death was multiple drug intoxication. But we were only taking one medicine at home.
you have some questions?
I do.
Multiple okay, go. Hang on. Clint's going to talk to you here and see if you can answer some of the questions.
I do. Allison, how old was your husband?
He was 51.
I'm so sorry.
Me too. It's awful.
Oh, boy. Yeah.
Was he working at the time?
No, he had taken the medical leave after.
Okay. Allison, what I want you to do is I want you to call my office. It's 824-3703.
Let me get a piece of paper.
What we'll do is we're going to go to a break here. Allison,
Yeah,
stay on the
I'll talk
line,
to her
and
off
we'll
air.
touch bases with you and pass that number on to you. Allison, you stay right there, okay? And we'll take a break and be right back with more of your calls, and that's a heart-wrenching call. We'll be right back after this.